Welcome to Thoughtful Thursdays. Today we are joined by Dr. Nebras, family medicine specialist, and we're going to talk about home care. Dr. Nebras, how are you?
I'm fine, very well, Dr. Tariq.
So thankful that you made some time to join us here and talk about this topic. It's a growing sector in the healthcare market, isn't
Exactly, it's my pleasure, Dr. Tariq. Yes, as our global population has increased in the numbers of elderly patients, so we should be prepared and we should make our most efforts to deliver the best care for our seniors citizen as well.
Yes, I
So
totally
I'm so
agree, yeah.
glad that you gave me this opportunity to speak about this topic and how to enhance the quality of their care and what's the advantage of having care for them in their own homes.
Yeah, so apparently this is, it's understandable, I think, that it's a big advantage to be able to stay in your home and still get the best care. But can you name a few things which make it an advantage?
Exactly, Dr. Tariq. One of the most important thing is that taking care for our seniors in their home is to provide them with the familiarity and comfortability with their our surroundings, and with their family, with their loved ones, and this will reduce the feeling of stress and anxiety if they being cared in another institutions. And this also is very important for them not to feel lonely and isolated from their family members, because the most important is the family foundation and the support from their family, friends, and neighbors as well.
Yes, and maybe I'm just thinking about something that came to my mind. When you're in your own home, you eat the food that you're used to.
Exactly, at the time you want.
Yes.
As well. So
Yeah.
it will be also a personalized and customized care, which tailored to their needs and their preferences as well. And this can be provided either by their friends, their family members, or by a trained professional nurses, for example, that can give them their personalized and customized care at home.
Yeah, and also you will be more involved in the dealings of your own nuclear family with, for instance, close relatives visiting and friends visiting, and they will come and say hi. So you might even be seeing people that you would normally rarely see. Yeah.
Exactly. That's why they will not feel isolated
Yeah.
and
Yes.
lonely.
Yeah.
And this it has a positive effect to their physical health as well as emotional well-being as well. Not to being isolated and to be involved in the decision of their big family as well.
Yeah.
They live their life in their own terms. Okay,
Yes.
with the support of the family surroundings as well.
Yeah.
And also their family and the caregivers for them, they have also their thoughts and insights, okay, and their opinion also for the evaluating the care they are having at home. It will be much easier, not like restrictive or timelined care in the other institution.
Yeah, and maybe also I'm just thinking of some other advantages, like you could sit in the garden.
Of course,
They
you
can wheel you
do.
out in the garden. You can sit there for an hour and then you go back
Yes,
inside.
and even they can do gardening themselves.
Yeah.
They grow the vegetables, which are a lot of our local people here in Al Ain they are doing. They
Yeah.
have their own farm, which is in their house, you
Yes.
know, and even they have the influence over the way they want to eat the vegetables, the way they want to make their meals and prepare their meals.
Yeah.
So this is also, it helps them to stay physically fit and active, as well as, you know, empower them. They are still having their rights and they're making their own decisions as well.
Yeah, I'm thinking that there probably are also disadvantages or challenges when you're in home care. I mean, it's of course things are a little bit less available than if you're in a healthcare institution, I would imagine.
This is also true. It depends on their health, on general health and their mobility, and if they are having a chronic illness that affect their mobility and even their mental health and emotional well-being. And also it depends on the location of their home. Is that their home is far away from getting a local service nearby, is far away from their family or their neighbors, as well as if their home is safe and remodulated in a way that ensure their safety and it reduce the risk, for example, risk of falling down, and in case of emergency, if they have a quick access to the emergency services. So all these factors, it can affect the decision.
Yes.
Okay, if there are better care at home or better care in another institutions.
And are there also provisions for a patient who is living in a home care situation to have a doctor visit them in their home? Is that possible or not?
Yes, it is possible. They can have regular checkup and visit by doctors and by nurses as well. They can even do blood tests them and monitor their blood pressure, their sugar as well, and they can also adjust their medication and make a plan, which is it is customized and changeable, which depends on their needs.
Would there also be a possibility, for instance, to give regular physiotherapy, for instance?
Of course, this is also it's available, which improve their physical ability, and also it can empower them and make them more confident in doing their daily activities.
Are there also, let's say, more advanced levels of care that can be given to patients in home care, like, for instance, dialysis?
There is a home dialysis for patients suffering from chronic kidney diseases, and which is more comfortable for them, even for the elderly, instead of leaving home and staying in the hospital for hours. And they are surrounded by their family and loved one, and even it can be adjusted to their timing preferences as well.
Yes. And is home care always related to another healthcare institution, or is it an independent sector? Like, does home care have to be affiliated with a hospital or with a clinic, or can you also have home care as a completely separately organized form of care?
It can be done in either way. It can be done in either way. Either it's part of hospital care and extended service from certain hospitals, or can be in a separate institution by its own.
Okay.
But in both ways, it is run by a professional and certified people from the Department of Health in Abu Dhabi, and highly trained nurses and doctors specialized in dealing with diseases of the old and senior people.
Yes, and I think delivery of medicine has already become normal, right?
Normal to their doorsteps.
Yeah, to your doorstep.
Yes.
So actually, do you think that maybe home care is a prediction of the future? Do you think it might be that the whole healthcare sector will evolve and turn into something which comes to you as care instead of you going to the care facility?
This is very interesting. Yeah, this is very interesting, and I can see it is near to be achieved in the future, in the soon future, because all of them, even when we do analytic studies or something, they do prefer, even they do ask, as a doctor, family medicine doctor working in the clinic, I've got a lot of my senior patients, or they are asking me, their families even, they're asking me, can we have such service in our home? It can be reached in our home, and alhamdulillah, we can provide this as a Mediclinic institution. We do reach our, care to our patients wherever at their home, and when there is a medical emergency or necessity, they should be trained when to call the doctor and seek immediate help, and to come to the urgent care and to be seen physically by the doctor there.
Yes, it's an interesting vision. What's good for the elderly patient, which comes, of course, from also from a very practical side, because they are less mobile and all that, and it has actually opened the door for all of us to think about, having more healthcare coming to you in your home. I don't know if you have read up a lot about the very interesting concept of the microbiome, and the microbiome being the bacterial environment inside our body, which is merged with the environment of the bacteria around us, so that when we are in our own environment, it's always healthier for us.
Exactly. Because a lot of diseases, it's affecting our body if we get something which is not used to get it throughout our previous years.
Yeah.
That's why it's our body is considered it as different or something abnormal. That's our body react towards. It will have symptoms of diseases as well. So if we are staying in our environment and comfort zone, not changing that, it will boost our health level and even our emotional well-being, which also it affects our physical health as well, because they are both connected together.
Yeah, absolutely. I'm also thinking that there are a few things which probably, I don't think we'll have a future without hospitals. Do you? Because if I can't imagine myself going and visiting a patient in their home and operating them in their home. I think that's a little bit too much.
No, this is very extreme. No, we can't do operation there. But we do still need the hospitals and the clinics. We do still need them. Depends on our needs, on the physical needs. For example, if patient's having heart attack, Allah forbidden, or stroke or something, he needs to be seen in the hospital, be managed in the hospital. We can't take all the other facilities to their home to manage there. But if there is, for example, the physiotherapy effect and exercise, or preparing healthy meal, giving them medications and timing the medication, adjusting this medication, doing a blood test, routine blood test and routine checkup, some of screening tests which can be done by taking blood samples. This can be done when they are at home. But other tests, for example, if they need X-rays or they need more intervention, they should go to the hospitals.
Yes, absolutely. I think that there is a small element of safety involved as well, that there are certain things which are just not safe to do in your own home. And also the things that are, let's say, acceptable to do in home care, there may be a little bit less monitoring available in the home care situation compared to in a hospital. Could you comment on that a little bit?
Yes, exactly. As I told you, Dr. Tariq, it depends on their medical necessity. For example, if elderly patient has heart attack or cardiac problem or something like that, all the monitoring should be done in the hospital, not at home. But for example, if they have just blood pressure, which is stable on medication, they can be monitored at home by the nurses or by their family as well, just to regularly check their blood pressure and record them. And they can even, nowadays we can do telemedicine consultation and follow-up calls with them. We can see the readings, video calling them, and we can check. So those simple things can be done at home, but the more interventions they need, depends on their medical condition, should be done in the hospital as well.
Yes.
And
well,
even it can give a peace of mind for both the elder patients and for the caregivers are there as well, and the family, because it is customized to their care. Okay, and there is one-to-one care by nurses or by a doctor, not as it is in the hospital when they are admitted to the hospital. This will also save their time, and avoid the repeated hospital admission or long-term stay in nursing homes.
Yes. Well, this was a very interesting conversation, Dr. Nebras. I'm so thankful to you that you made some time for us to share your insights and your expertise with us.
My pleasure.
And thank you very much.
Welcome anytime. Welcome anytime.